Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
And what we see in the fall is a spike in all three of the main respiratory viruses that tend to drive a lot of ER visits, urgent care visits, and unfortunately, even hospitalizations.
The cold and flu season is now more than just that. RSV and COVID are now also part of the seasonal respiratory virus lineup. While we do have vaccines to fight this trio of viruses that cause fall and winter misery, health officials worry that shot fatigue and hassles in getting them will leave too many people unprotected. Here's Dr. Nicole St. Clair, Executive Medical Director for Regents.
So the time is now. We're right in the peak season for everything. So if you haven't already, it's definitely a time to check in with your provider.
This fall and winter, the CDC expects we'll see a similar number of hospitalizations as we did last year.
We're starting to see an uptick of these respiratory viruses, cough, colds, and flus. Kids are missing school, parents are missing work. Some of it just has to do with the nature of these viruses and how they cycle.
Vaccines are the safest way to build immunity from a virus. The CDC recommends everyone 6 months and up stay up to date on those seasonal flu and COVID-19 vaccines. And yes, you can get them both at the same time.
But the reason we get a flu shot each year is because the flu actually changes just a little bit. So we're able to take information that we can gather from the previous flu season and use that to tweak the flu shot a little bit to try to make it even more effective this year.
That's the case with the COVID shot as well. Now, the rollout of the COVID vaccine this year has been slow to many pharmacies, but there are local resources to help you find one. All right, now let's talk about virus number 3, RSV, also known as respiratory syncytial virus. It usually causes mild cold-like symptoms, and most people get better in a week or two. But RSV can be serious for some.
It's extremely common. However, it can be really significant and causes severe illness in extremely young babies and newborns, as well as seniors can have a little bit of a stronger response to it.
The CDC recommends all infants and young children get vaccinated against RSV. And now vaccines are approved for adults 60 and older. If that's you, talk to your healthcare provider to see if it's right for you.
With all of the respiratory illnesses that we've talked about, influenza, COVID, RSV, they all can lead to complications such as pneumonia. And once you go down that pathway, that's how people can find themselves admitted to the hospital.
And there are more ways to keep the season of sick at bay. Wash your hands, cover your cough, stay at home if you're sick, and consider wearing a mask. For more information about this year's respiratory virus season and links to find a vaccine near you, visit kgw.com/healthiertogether.